Hi, I'm Steve. You can call me Steve. I don't know about you, but I'm not a fan of smokers. I'm sure most of them are very nice people, but when they're indulging their habit, they're surrounded by clouds of noxious fumes. You can tell where they congregate because the ground will be littered with discarded cigarette butts. Full disclosure, I come from the interior of British Columbia, where entire towns have been lost to forest fires caused by some jackass throwing a lit cigarette into the bush. I don't have a completely detached, dispassionate view on this. Likewise, drug addicts will often leave discarded needles lying around, which can cause puncture wounds and transmit diseases if they're carelessly handled by someone else. Both of these are aspects of addiction that negatively affect communities. It is therefore in the best interest of communities to minimize the effects through a process called harm reduction. Harm reduction is a specific term within the public health field that refers to a specific addiction treatment approach that does not require the patient to immediately quit. Addiction is extremely hard to overcome, and most people will require multiple attempts. Going cold turkey is actually one of the least effective ways to quit smoking. While a person is going through the process of quitting, they will continue using the substance they're addicted to. Sometimes they might not even quit at all. Harm reduction doesn't have an end goal. Its purpose is right there in its name, the reduction of harm to the patient and to the greater community. For smokers, this might mean a nicotine patch instead of cigarettes to remove secondhand smoke. For more serious drugs, harm reduction might take the form of a safe injection site or a needle exchange program to reduce discarded needles littering parks and playgrounds. While that first approach can be used as part of a quitting strategy, the latter two aren't clearly involved in getting people off drugs on the surface. However, bundled with them are programs to provide drug treatment resources and counseling in a safe, medically supervised environment, where patients can gain access to other programs and forms of support, like housing or income. Even if patients don't quit, they're using in a safer manner in a controlled environment, rather than out on the street. They're not discarding used needles for kids to find, which reduces transmission of HIV and other diseases. Harm reduction isn't some theoretical proposal only discussed by academics. It's been used for decades in places like Denmark, and 3 days before I posted this video, BC's provincial health officer recommended decriminalizing possession for private use of drugs that are currently illegal. The results from these active programs show that a lot of predictions made by their opponents over the years did not come to pass. For example, safe injection sites do not lead to an increase in crime. These are all measured, documented outcomes of programs that are already up and running. I'm taking these facts from the webpage of the Canadian Mental Health Association, which I will link to in the description if you want more detail than a superficial 5-minute video can provide. Harm reduction is a pragmatic, non-judgmental approach, which recognizes that drug use is going to happen. Any approach that doesn't acknowledge that will not be effective. Harm reduction accepts the situation on the ground as it is and builds its strategies from there, rather than from the ideal situation that people might wish was present. It runs into resistance from certain sectors of society who don't want those people in their neighborhoods, or who don't want to encourage what they see as disreputable behavior. Except we've been trying that for decades and it hasn't worked. It comes down to whether you see addiction as an illness in need of treatment or as a moral failing. You'll notice I've been using the term patient and not addict. Punishing drug users for being addicts will only guarantee they will continue to be addicts, and that the societal harm around addiction will continue without abatement. Harm reduction treats addiction as a health problem, not a moral problem. Addicts are patients, not failures, and they deserve support and dignity while they're dealing with their addictions, because it's not something they can do alone. I should probably give my friends who are smokers the same courtesy. If somebody broke their leg, you wouldn't expect them to walk it off and heal on their own. It requires a medical professional to set the bone properly and apply a cast to keep it immobile while it heals. Addiction treatment requires medical professionals and counseling in the same way. That's harm reduction. It's a scientific, evidence-based, pragmatic approach to dealing with addiction and its secondary harmful effects on users and communities. It does not encourage drug use and does not lead to an increase in crime or other negative effects in areas where harm reduction programs are running. It's a non-judgmental approach that recognizes addiction is a health problem, not a moral failing. It also requires strong, sustained government support, which is hard to get when governments tend to frequently oscillate wildly between diametrically opposed ideologies. Thanks for watching. I've been Steve.